Hey everyone, it's Connor here from Durham Hearing Specialist. I hope you're doing well and welcome back to another update on this dead skin patient. Now, I'm just taking a sample here, which I'll explain about in a moment. But yet again, this patient has come to see me 4 weeks later. His ear is just clogged with moist dead skin. So the condition is still ongoing. Now, if you're not sure what I'm talking about, I'll link you to the previous videos regarding this case. But essentially, this is a patient that we've been following on the channel for a short amount of time. And he first presented to me a while back with, this very sort of pale cottage cheese-like debris in the ear. There's no pain, there's no pus, there's no obvious inflammation, no swelling, heat, so on and so forth. So it's a bit of a mystery as to why this is happening. So this is what we call rapid desquamation, or rapid cell turnover. So the skin cells in the ear canal are dividing very, very quickly, and we don't know why. So I've had discussions with his doctor. We've had him referred to ENT, or an ear, nose and throat consultant. But the update to this case, there's good news and bad news. So the bad news is obviously he's come back to see me again, and the condition is ongoing. To compound matters further, he's still just waiting to hear from ENT. So that's how long the waiting list is in the UK at the moment. ENT it takes a long time not only to get an appointment, but then you have to obviously wait to see the consultant. So it's very, very difficult at the moment. So that's the bad news. The good news is I'm fairly sure I know what's wrong with this patient. Now, I won't spoil it for you, but that little scoop, that little sample that I took right at the beginning of the video, I decided to, when the patient came in, I thought, you know what, I'll take another sample just in case I missed something the first time round. So if you look back a few videos, you'll see that I did a video where I put the sample underneath the slide. So I think it's called Dead Skin Under the Microscope. But when he came before, I took a sample of the debris, kind of smeared it across the microscope slide, and then stained it to look for white blood cells. So if you get pus anywhere in your body, then if you put it under the microscope, you will definitely see white blood cells. And it's difficult to see them under the microscope unless you stain it. So, they'll often be stained with the sample will be stained with like a kind of bluish purplish dye. So that'd be Giems's stain or Wright stain or HE stain, something like that. So when he came previously and I took a sample, I stained it with Giems's stain and didn't see any white blood cells. So I thought, oh damn, okay, it's probably not an infection. No, there's no pus kind of mixed in with the dead skin. Maybe it's autoimmune. I consulted a few different doctors. They didn't know either. However, I decided to take this other sample, which you've seen, and I put it under the microscope and I did a different test on the debris, and I think I have the answer. So I won't spoil it for you, but the next video that I upload, I will show you footage from the microscope so you can see as well exactly what I saw. So it's very, very interesting. But I thought I would share just this quick suction with you. Again, it's pretty much the same thing, an easy suction to a degree because everything's so soft and so on. The downside to this, to these cases, which are rare and few and far between, but it gets to a point where the debris just kind of constantly blocks the suction probe. So it takes a long time, unfortunately. As you can see, the eardrum is just on the other side of this big sheet of debris here. And I'm just trying my best to kind of clear it with some sodium bicarb. So if the ear canal ever looks wet as I'm going in, that's because I will have applied some sodium bicarb drops to the ear, which I kind of deliver through a metal funnel into the ear canal. But again, just taking away bits of debris here. So again, the video is edited, obviously, so everything looks kind of super slick and lovely. But again, just here, like every time I have to kind of, something blocks the end of the suction probe, I have to withdraw and get it off and then suck some water through the suction probe. So it's a very laborious process. And you know, all the time I'm taking away these little bits of debris slowly, slowly. Again, the patient's getting a bit, not agitated, but again, there's only so long that someone can sit still and tolerate this. And as well, my arms are getting tired. So again, when I'm doing this procedure, it's, you know, I don't have the patient lie down on a bed, so my arms are kind of literally like this all the time. So again, it's but we managed to get there in the end. So the eardrum, again, what you're looking for is that kind of bluish skin, bluish purpley grey skin. That's what we're looking for, and you can see now we're starting to uncover it. You know, so maybe I was an archaeologist in a previous life. Who knows? But we're slowly but surely uncovering the eardrum from this debris. And again, you know, this would be a perfect case for irrigation, you know, because it's kind of softish debris. It's kind of stuck to the eardrum, right? In my view, I mean, I do it from time to time, remove stuff from the eardrum, and it's not difficult per se. It's just awkward, and it's not particularly nice for the patient. So these days I tend to favor irrigation. You know, just 10 to 20 seconds of irrigation using the right technique, and it'll just kind of clean the eardrum like that. But in this case, I'm quite hesitant to get the ear canal wet. It just doesn't make sense in this particular case, just in case it is an infection. But here, again, we're just removing lots of debris slowly but surely. Again, everything's kind of wet here, sodium bicarb. And I don't particularly mind applying sodium bicarb because although it's a water-based drop, fair enough, but it does have very mild, probably insignificant, but very mild antimicrobial properties, I think. So it's got a slightly higher pH than what bacteria would like to live in. So again, just the sodium bicarb is actually really helpful because it just kind of lubricates everything and allows things to kind of suck up through the suction probe like they're supposed to, rather than kind of blocking the end. So I'm just digging this last bit out here out of the recess, which again is a little bit difficult. And the suction machine here is turned up pretty high, so it's running at about minus 550 millimeters of mercury, which is a lot. So that's you know, that's kind of where my machine maxes out. But we are making good progress here. So now we're not going to be able to get every little single tiny grain of dead skin off of the eardrum, but the point is that we just want to restore this chap to normal hearing. And again, you know, the whole kind of saga of me seeing this chap is really just supposed to be a bridge until he sees the ENT consultant, and then the ENT consultant can treat the underlying cause. Now, I don't know when he'll be seen, but as I said, I think I found what the problem is, and I spoke to his doctor today, and we think we've come up with a suitable plan for him. So again, everything's looking pretty good now. So I have to say, looking at the video, you could probably say that the canal is there's a tiny little bit of inflammation there, potentially. But again, there's never been any pain or, you know, any kind of purulence there, or purulence is pus basically. So there we go. It's a fairly good outcome. So it doesn't look pretty, but again, we're not really looking to beautify the ear per se. We're just looking to return normal function. So there we go. That is part one of the update. Just a quick clear out. Now, what I did after completing the case is I had some free time. I put the debris under the microscope, and that's when I think I managed to solve the case. So stay tuned. I will go ahead and edit that video now, and hopefully I'll have it up within the next couple of days. But if anyone can guess what the answer is, then leave a comment below. So I did do a post on the community section of the YouTube channel with a clue. So if anybody knows what the answer is, leave it down in the comment section below. And if you know, then I will give you an answer bear. There we go. So I will see you guys on the next video.